Quite frequently, a patient will ask me, "So, doc, when you get hurt, what do you do?" And I felt like this was a good opportunity to discuss how I treat myself when I deal with a musculoskeletal injury. And the timing's pretty on par because I am dealing with a little bit of a knee injury, which I can fairly confidently point to as being patellar tendonitis, maybe a little bit of meniscal degeneration damage, probably not a tear. Um, but it's something I'm dealing with right now. And it gave me the idea that, hey, why don't more people know how I treat it for myself? For those of you that don't know me, my name is Dr. Nikhil Verma. I'm an interventional pain and musculoskeletal health expert in Columbus, Ohio, and I focus mainly on regenerative medicine and more functional ways to heal our musculoskeletal injuries without using medications, injections, steroid injections, or relying on surgery. My knee has been bothering me for probably a few months now, longer than I would like to admit, because just like everyone else, you ignore the pain until it becomes a problem. And over the past few weeks, it's starting to become a problem because it's limiting how I can lift. So instead of taking the advice of resting, taking non-steroidal anti-inflammatory medications, and doing injections, I went back to what the evidence shows. So I'm starting to take my knee through physical therapy regimen that I've set up for myself. And if you don't have the knowledge or understanding of how to set this up for yourself, then that's the time you go work with a physical therapist or a chiropractic therapist that's trained in rehabilitation processes. Um, so that's what I'm starting with. And I'm working from the foot all the way up to the back. So I'm not just treating the knee. I know on my gait pattern and my gait analysis is my foot actually collapses internally. It's called pronation of the foot. And it's because I have a weak arch on that side. So I'm working on strengthening up that arch and doing different foot exercises and stretches to help that out. I'm also working on the calf muscles and the Achilles to help stretch that out to make sure it's not too tight. I'm working on some of the tibialis anterior. Now, this is not necessarily proven to be beneficial, but I find it to take some stress off the knee. I'm working on knee rehabilitation exercises. That can look like deep knee squats. That can look like single leg squats to depth before it hurts. That can look like terminal extension of leg extensions. It can also look like doing leg extensions themselves, isometric wall sits. So that's kind of working the knee. And I'm also stretching and strengthening the quad muscle on the front and the hamstring muscles on the back with a lot of these same functional patterns of not progressive overloading. I'm not trying to build muscle here. I'm not trying to build strength. I'm trying to build stability, which is a lot different. That also translates up to strengthening and stabilizing the glute muscles, which can help protect the knee. I'm also working on low back and ab exercises to help stabilize my core. And if you start looking at this as a kinetic chain up and down, then you can start looking at, hey, I'm not just treating the knee, I'm treating the whole environment to make it a better place for my knee to improve and get stronger. And the reason this knee probably took extra strain is because there's weakness in these other places, either partially or fully. So I'll go back to that foot collapse that I was talking about. I know I have that. I wear shoes that don't always support that the way I do. So I either have to be conscientious to walk with the strong supported arch, put an arch support in there, or I just need to find different shoes. Alternatively, I could get a knee brace to offload that part of my knee. So those are just some ideas of how I could have treated myself. Now I'm trying to be do my due diligence and help myself, but I also know when I run in the certain shoes that I wear, which I quite frequently wear to the office, that I still wear to the gym, the same type, and that shoe does not have a good support. So when I'm running on the treadmill or even running outside, that foot collapse gets exacerbated, especially over repetitive stress. So that's kind of what I'm dealing with right now. So I've had to stop doing my squats. I've had to stop running for a little bit. I've had to stop doing Stairmaster, and I'm working on rehabilitating my knee. But what other things am I doing? Right? I'm not icing my knee. I'm not taking non-steroidal anti-inflammatory medications. I'm taking Tylenol if it's really, really bad, and really, really bad has to be above a 7 out of 10 for me. Um, I try not to limp. Limping actually, unless the pain is so severe, limping actually trains the body not to use the musculature around it. It's inhibition to the muscular groups that could help protect it. So I'm working on the strengthening. I'm also using my laser therapy that I have here in the office to help decrease pain and decrease inflammation, which can help significantly. I'm doing that 2 or 3 times a week. Um, I'm constantly stretching and moving the knee. I'm not letting it sit still, and I'm working on full range of motion, trying to get into a deep knee bend or a hip flexion stretch, or stretching the calf, as we talked about, stretching the Achilles, stretching the tibialis anterior, and strengthening the tibialis anterior. So that's the front part of your shin. So all these exercises and modalities are helpful to help that knee. Now, if this doesn't get better in the next 2 to 3 weeks, where I can go back to doing those activities, that is the time I'm going to go call my physical therapist colleagues and say, hey, I need to come in and see you. Because my colleagues can do things like dry needling, they can do ultrasound, they can do shockwave if they have it. They can also help keep me in check. And I say that because quite frequently we think, oh, I'm doing everything perfectly. Why do I need a physical therapist to tell me how to do exercises? Especially if someone like myself who's been exercising for almost 30 years now, right? Like that doesn't make sense why you need someone to teach you. Well, it does, because there's something called verbal cueing. And when we do verbal cueing and understand, hey, you might not be feeling this, but you're activating the wrong side of this muscle. Or your gait pattern when you're stepping, you're not doing this correctly. And when you have another set of eyes telling you these things, it takes a few verbal cues for people to learn. And after about 7 to 10 repetitions, either externally or internally, or a combination of both for someone in my case, then something clicks, and then you start understanding, oh, now this makes sense. I will start using maybe a topical rub if that pain gets to that intensity. Right now, I want my body to try to heal it as much as it can naturally. But I also need to make sure my environment is as healthy as possible. So I'm not eating highly processed foods. I'm not eating sugary foods. I'm eating a highly lean meat diet with lots of fiber from different sources. I'm eating lots of vegetables. I'm eating lots of fruits, and I'm taking high dose fish oil. I'm also taking vitamin D. I take those year round, but these are things that are going to help in my recovery process. I'm also sleeping. I'm making sure I'm getting at least 7 to 8 hours of sleep a night, minus those nights I'm working late, or I have something to do the next morning, or whatever stressors might come up in day-to-day life. I'm staying hydrated, drinking lots and lots of water. There's some other evidence that's saying sauna therapy can help musculoskeletal pain. So I'm spending much time in the sauna. Because I'm spending time in the sauna, I'm making sure I'm staying hydrated on the before and after ends of that, to make sure that my body has enough hydration to do what it needs to do. And I'm going to continue this for, a few weeks, right? If that doesn't work, then I'll go to the physical therapist. If the physical therapist isn't able to help me, then I'm going to consider getting the x-ray. After that, that's where the orthobiologics might come in. We might start talking about PRP. We might start talking about if there's bone marrow lesions, mesenchymal signaling cells, mesenchymal stem cells injected into that area. But right now, I'm going to continue to do what I do to strengthen and rehabilitate my knee to get it back to a functioning level. Anyways, I hope you guys found this useful. I hope you found it interesting. This is what I do to help my recovery process. This is how I help myself at the end of the day. If you have any questions, comments, please drop them below. If there's any topics you'd like me to cover, we'd love to chat with you. And I hope you subscribe and like, and we'll talk to you next time. Take care. Bye.